Thank you, SNI and CAPH, for recognizing the work of Contra Costa Health Services in the category of population health. One of the things we saw early on in the COVID pandemic was many people putting off needed prevention, screening, and care. Our teams here at Contra Costa Health Services leveraged all the tools available to us, technology, other kinds of outreach strategies, and in the end, bringing in interns, doing that one-to-one contact using the phone, the things that those of us at the safety net really do best is really having a relationship with those we serve. Thank you so much again for this important recognition and for highlighting the need for people to get the care and prevention to live healthy and long lives.
The before state was we would generate list of people, patients that we need to outreach to. Those lists would be sent via email to various clinics. Clinics would do the outreach. The challenge was the lack of coordination because it would lead to over outreach. We would end up calling the same patient multiple times in a week, and then there are some patients who do not get called because they were not in one of the list.
Even though we've been on an electronic health record system for the last decade, we've found that our outreach efforts have been primarily manual over many years.
So kind of inefficient process, not exactly patient friendly, and we were not tracking outcomes. So that's when this idea was proposed. How about we coordinate all this through our electronic health record? All outreach should be done through a list in the electronic health record and documented in the health record.
Slowly we got a team together. It started with summer interns from college and high school, and we put them to work making phone calls, just saying, hey, you know, you're due for your mammogram. Would you like me to schedule that for you? Your wild child care, child visits, your immunizations, etc. So that's how it kind of organically started, and we found that it was very successful.
This information is available in real time for anyone that's hooked up to our network to know exactly what every individual patient requires. And so we've been able to scale this in a fashion that we've never been able to do before, which has been pretty amazing. We've gone from several hundred phone calls a month to on the order of 5,000 to 6,000 phone calls a month. And the number of people that have been able to receive care based on these phone calls has significantly increased. And we're not doing it with additional people. We're doing it with fewer numbers of people. They're just much more better able to understand and appreciate what they need to do. They know when to call, what language to speak, what the patients need. There's not a lot of back and forth. These are tasks that get completed very effectively and efficiently with very good outcomes.
And once that outreach is completed, we could actually now go back and track of those people who received a phone call from us, how many of them came in for services within the next 15, 30, 45 days. So we could measure the effectiveness of our outreach, what's working, what's not working, and then we could adjust that outreach based on, maybe certain time of the day works better, maybe sometimes the day of the week works better. So in terms of outreach, we are looking at the data. We see that we have seen an improvement in our well care visits for between 3 months and 21-year-old by about 10%. We've seen a similar increase of 6% in our diabetes eye exam. A1C control has improved by 3.5% since we put together this approach. Hypertension control, the rate has improved by 10%. So we are seeing across the board improvement.
I personally know of 2 cases of women who went and got their mammograms, both of whom had cancer. They both were diagnosed and treated successfully with their breast cancer because of the calls that we made.
For those patients that we know of that had positive outcomes from what we've done, this is super meaningful. And if we can continue to scale so that we're reaching more people, we'll continue to have a better impact on our community.